While some viruses are more harmful than others, they certainly know how to play tricks on the body's immune system. And now new technology and research in the works may help uncover how certain viruses are hiding in the body's most vulnerable spots, attacking human diseases better and faster at a rate science has not seen before. It's one of Erica Ullman-Saphir's main goals. World-renowned pandemic expert and professor at the La Jolla Institute of Immunology, Ullman-Saphir was on the forefront in developing vaccines for the first batch of Ebola virus outbreaks. Published this week in Nature Structural and Molecular Biology, Ullman-Saphir and her team share part of their 3-year effort in developing a vaccine from an Ebola survivor's antibody.
We can't be working and figuring out how to cure the last outbreak. We need to learn how to cure this outbreak now.
But finding a vaccine, let alone a cure, is quite a process, especially since viruses are so complex.
Viruses are complicated for 2 reasons. One is if they're constantly mutating and changing, there could be a million different varieties. And yeah, we could confer one or another, but coming up with a vaccine or a treatment that could be applicable against every single kind of HIV or every single kind of common cold is hard.
Hard to develop, but Ullman-Saphir firmly believes cures are out there and very possible to achieve. A first big step, high-resolution imaging from cryo-electron microscopes. The images will provide a precise anatomical understanding of what these pathogens are made of. It'll also equip scientists with the ability to see what these viruses have in common.
Our microscopes used to show us blurry images, and when we try to get a high-resolution view, it would take us years. Well, now we can do it in weeks.
These microscopes won't just help in developing vaccines for viruses, but also cancer and diabetes. But Ullman-Saphir isn't just a scientist to be found in the lab. She and her team have been making the rounds in Congo.
The current Ebola virus outbreak is in a conflict zone. And so treatment facilities have been attacked, others have been burned. It's very difficult to get in there to do the work that's needed.
Despite the challenges, Ullman-Saphir and her team continue to survey those infected with Ebola to see what type of Ebola virus they may be carrying, as well as their reaction to treatment. With the incoming arrival of the new technology, Ullman-Saphir believes it's an exciting time in the world of science. Ullman-Saphir says she expects the new imaging facility to be up and running by this coming spring. At the La Jolla Institute, Natasha, Sweatte, RT.